Hello and welcome. We are excited to kick off our next panel on longevity and survival. The discussion will focus on at-home diagnostics using blood markers and be moderated by Scott Amyx, Managing Partner at Astor Perkins. Joining Scott is Dr. Angelica Kohlmann, MD, PhD, and Chairman of Bloom Diagnostics. Scott, take it away.
All right, great. Thank you so much for Christine. I appreciate that. And Angelica, what a pleasure to speak with you again. Just to kind of help start us off, if you could introduce yourself and your company. And really the first question, just to help everybody get grounded, is why do we need this when we can look to genetics and genomics? Please.
Yes, wonderful to be here. Thank you, Scott. Thank you, Christine. So I'm Angelica Kohlmann, co-founder of Bloom Diagnostics. My background is I'm a medical doctor. I worked in research for a long time. We invested in some biotech companies, which were very exciting, and ended up founding our own company because we thought there was a need, and we'll come to that, right?
Absolutely. So my question was really, for those that are asking the question of why do we need these at-home test kits that are examining our blood? And what specifically does the blood tell us that looking at our genetics, for those that have done 23andMe, for instance, can't give us information about?
Right. So, in fact, it's very complex. And this session is about longevity. And that means we want healthier lives. We want to live longer in the end, longer, healthier, better. And for this, we need information. And as you said, we have a lot of genetic information. Of course, we also get clinical information about blood markers. But this is not standardized. Every lab has different standards. So there is a lot more that can be done here. The reason to found Bloom was, first of all, to offer a better access to healthcare to everyone. So everyone in the future, and starting from September when we launched our first tests, will be able to check for their health regarding blood markers at home or in certain drugstores or pharmacies. And this will give them immediate information, actionable information. But in the background, perhaps just to, we will learn a lot about the clinical data as opposed to the genetic data, because the genetic data gives you the information about what your genes tells you, but in the end, it doesn't say what your body does with that. And we need the information, what did your body do with that? Because that's different from person to person. And that's what we learn. We get a lot of information and we learn from this information, and we can better help people to improve their lives. And we can even help the pharmaceutical industry to develop better therapies.
I really like the way you explain things, and again, it is very complex. But for those that are watching or listening, we want to be able to actually make it digestible for them. And to your point is, in some ways, genetics is something that's kind of predetermined. In some ways, we're kind of looking in a rear view mirror. We can't do anything about it. So if we have a propensity for diabetes, or perhaps maybe a certain type of cancer, for instance, but the blood marker, what's in our blood, in our system, is more of a real-time assessment of what's happening right now. And to your point, it's not only personalized, but it gives you more of a real-time perspective of your current health conditions. So the blood tells us a lot. And typically, all of us, we've all gone to a lab clinic and gotten our blood and urine work done, for instance. Why is it important that we do this at home and be able to do it in a way that you guys have designed it?
Well, of course, it's much easier, cheaper, faster. And people today want to have everything now, here, and immediately. So there are many good reasons to offer this service at home. The future of healthcare will look completely different than what we have today. So if you don't feel well, you wake up in the morning, you don't feel well, you will ask the Bloom app, ideally, of what is going on. You will answer some questions, and you will be guided towards what you need to do. For example, taking certain tests. And further, the app will guide you after perhaps you perform the blood test It will let you know what is necessary, and if a drug is necessary, of course, is the future, but the pharmacy next to you will be informed at the same time, and the drug you need will be on the way to you. So all this is possible. Of course, regulators need to speed up a bit. There are many challenges, but most are not technological challenges. And we're trying to break this big wall towards creating a more accessible healthcare, which is not only more accessible, but much better because it's faster. It can save lives because it's faster. People can find out what they have much easier, much faster, and they can be treated also, right away. In the background, we learn much more about all those conditions because big labs, they don't learn at all. They deliver the result of blood markers and that's it. And we are learning. We can say, oh, look, it's all anonymous, all encrypted, but all GDPR compliant. But in the background, we say, look, there are thousands of people with certain conditions who are taking certain supplements. So maybe this is not so good, or maybe other supplements are ideal for this condition. So it is really about improving health.
So we're going to come back to the incredible value from the data that's derived, but let's try to stay with a little bit more kind of the fundamentals for those that are kind of cringing at the thought of having to take blood samples, because again, their point of reference is going into a lab and then getting blood drawn, and sometimes vials or bags or whatever it is. What kind of amount of blood are we talking about, and what's a process to do this at home?
Yes, right. That's a good question, of course. So what Bloom developed was designed to be very simple and easy to use for the consumer, for the customer, meaning that everyone today knows what a home test means. If we think of COVID tests, what Bloom developed is tests for which you need to take a drop of blood. So when you buy such a test kit, it's a very small test kit. There is a prick, there is a Band-Aid, there is a little thingy with alcohol to clean your finger, and that's it. You prick your finger, you put a drop of blood on the test strip, then you insert the test strip into the small Bloom lab. So this is a device we developed. It's an optical device with a lot of firmware or software in it. You insert it in this device, and the device will make a quantitative measurement, which is also very new, that people can perform quantitative tests themselves. It's not a yes or no, like pregnant or not. People know pregnancy tests. So it will give you a precise value. But most people don't know what a value means. So on top of everything is the Bloom app. The Bloom app guides you through the process, has short videos showing exactly step by step what you need to do, how to prick yourself, how to put a drop of blood on that carrier, how to insert it into the Bloom lab. And then you need to answer questions. And those questions are personal, as said, all encrypted. No one can see it. We cannot see it. No one can see it. You answer those questions, but that is very important because personalized medicine today, it's understood, is the key of the best treatment, meaning we need to know the patient very well in order to be able to give the best possible treatment. So we ask all those questions, and the IP of the company is that instantly in the cloud, the result of the test is combined and all is calculated together with the information you gave, like which medication do you take, how old are you? And all this within seconds, in fact, is translated into a result to you in words, which any layperson can understand and can follow the recommendation, right? So people can order those tests to their homes. They can also order a lab to their homes in Europe, where it's approved, not yet in the US. And they can receive actionable results on their app, which are extremely helpful. And we're very excited. All the first patients, customers, users in Europe are extremely happy with that immediate, instant, actionable result.
This is very exciting, and it's exciting for lots and lots of different reasons. But I wonder, well, first of all, again, because for those that are watching, maybe it's the first time they're being introduced to Bloom Diagnostics. Can you talk about the different tests that are currently available and approved, and also what is in the pipeline?
Yeah, sure. So we of course had long thoughts on which would be the first tests. The goal, of course, is to offer hundreds of tests, and not only to offer hundreds of tests, but today we still need 1 drop of blood for 1 test. In the future, we will be able to have 2 or 3 markers tested out of 1 drop of blood, and the idea is to increase that. But it's step by step, it's hard work. So where did we start? We found out that iron deficiency is a real topic. It's very serious. Many people are affected, mostly women, and up to 25% of the population do have iron deficiency at some time in their lives, and they don't realize. So we decided to go for this one marker, and we found that in the first weeks after launching, so many women found out that they had iron deficiency and they didn't know before. And they started taking supplements, and they found that after some weeks, a month or 2, they were out of that iron deficiency and they felt so much better. Also important to know, we know that FDA is very concerned about self-medication, but there is another very important aspect. There are some people who have an iron overload, which is even more dangerous than iron deficiency because it damages the liver. And some people don't feel well, and they may think that they have iron deficiency, and they may think that they're doing good for their bodies. And here comes longevity. No, it's very harmful if you have enough iron then to take iron supplements. So you should check before you make a decision. And this is valid for many other vitamins or whatever you plan to take. So people with high levels, good levels or high levels of iron should not take supplements. So here is also an important tool to help people making a decision.
Now, for those that are thinking, well, iron deficiency is very important, but it's not really as relevant for me. Are there other tests that's coming down the pipeline that's going to be available?
Yes, so we have another test which is focused on the female population, which is AMH. AMH is a egg cell reserve test, meaning that women, when they get older, today women tend to have children at an older age than it used to be, their egg cell reserve may already be very low. And AMH reflects their egg cell reserve. It's not the only parameter for fertility, but it's a very important parameter. So we're offering this test, and it's the first test globally which can be performed at home and which offers instant results at home. Of course, we have many more tests in the pipeline. We have a TSH test, which is the thyroid test, so you can check for your thyroid gland. We have an inflammation test. We have certain infections which you can test at home. We have liver enzymes which you can test at home. They're all in the pipeline. We have a kidney test which will come next year. So in fact, organ checks, a number of checks, which we start, of course, with those which affect many people. So we will not start with a niche to be broad. At the same time, as we are creating a new market and people need to learn how to use that tool, we will not start by bringing a test which may mean life or death to the market, right? It is too risky. So we bring those which are very actionable, which will improve your life, make you healthier, but they will not decide over, if like a heart attack or something like that. So this is something we would not do. For sure, it will come in, 10 years, but for now it's too early.
Well, it's really exciting, and I think the reason that I'm excited about it is in the context of recent COVID, we've seen just the incredible overcapacity and just overutilization of hospitals and, of course, clinics as well. But more importantly, I think people have been reluctant to go into hospitals or labs because of potential dangers of getting infected. So this gives people an opportunity to be able to actually know what's happened in their system in almost a real-time basis. And to your point, I think it's interesting because we could be over something, whether it's diabetes, or we could also be under, whether it's blood insulin or something to that extent. So it gives us a real correct, accurate pulse in terms of our health, and we could do that at the convenience of our home. Why is that important, even outside of a pandemic?
Well, I mean, health is the most important asset we have, right? And fortunately, today, healthcare is very advanced, and we live much longer than we have lived 100 years ago. And technology makes us live longer and live better, not only longer, but also better. And this is another technological tool which will allow people to better handle their lives. The people are more aware about their health today, and the healthcare system cannot cope with that. There are not enough doctors out there. Their hospitals don't have the capacity. We saw it during the pandemic that they were overwhelmed.
Mm-hmm.
But even for the everyday healthcare, the capacity is very low everywhere globally. And that means that we need to offer people tools, and people today are much more literate in this respect. I mean, who would have thought 30 years ago that someone would be capable of running a computer? Who would have thought they need a computer? If 30 years ago someone would have asked me, do you need a computer at home? I would have said, what do I need that for? I don't need a computer at home. And now I couldn't live without a computer at home. And the same will apply to healthcare. You having certain tools at home where today you say, well, do I need that? But in the future, you will think, how could I have lived without that before, right? So that's the vision for the future, understanding your health, allowing lay people to use it as today lay people use computers, to know what is going on, what is right for you, what is wrong for you, and when do I need to go and see a doctor? When do I need to go and to ask for real professional support?
So I want to talk a little bit about cancer. Depending on where the viewers are based out of Europe or North America, let's say, is that depending on your insurance, you may be and also you have to have a certain age threshold as well. Is you may only be allowed to have a CAT scan or MRI or even blood work maybe once a year if you're lucky, maybe twice a year. But the problem with that is, especially when it comes to different types of cancer, let's say cancer in the blood, for instance, if you could have detected it sooner, you could have done something about it before it became terminal. Why is the ability to be able to do these tests at home at any frequency so important to that prevention and to ensure that you in a very cost affordable way that you could actually stay ahead of potentially very dangerous types of diseases?
That's an excellent question. It hits the nail. Today, regulators are not ready to approve cancer testing for home. And I guess for a good reason. People are not used to testing themselves at home. And imagine how someone would feel having a cancer marker which shows positive at home without anyone to support. So regulators are afraid of the psychological effect it may have. And once people learn to take care of their health, and once they are more educated, as we became more educated regarding computers, people will understand that a marker which went up a bit, a cancer marker, this may mean that really there is something, or it was just, it can also happen without cancer. So, but this is a sign, okay, I should go and see a doctor and really check, right? So if it was wrong alarm, the better. If it was a right alarm, you found it so early that it will most likely be cured. Today, cancer is not a death sentence. And the earlier, as you said, the earlier you find it, the better. So I really foresee that in a number of years, once health testing at home is implemented, people once a year or twice a year will do a cancer check with perhaps the 10 most likely cancers. And if they see that something is showing positive, they will go and see the doctor, and the doctor will say, "Oh, wonderful, you came so early. We'll handle that, and we will cure it." So a very important tool to help people to find certain conditions very early.
Amazing. So let's get into a little bit more of the company aspect. So, well, first of all, can you describe how big is this market that you guys are tackling, and then transition to talk about the company itself in terms of the founding, the team, as well as the capitalization and where you are in terms of the company lifecycle?
Right. So regarding the market, it is very hard to tell because we're creating a new market. What was the market of personal computers 30 years ago? It was zero. And today, the market for this kind of home testing, digital home testing, is almost zero because there is hardly any digital home test. So we're creating a new market, which is very tough. But we have, of course, we looked at certain markets, for example, for certain markers, but we also looked for the market regarding blood testing, and that's trillions, right? So where exactly are we tapping in? And to be honest, we don't really care. We're creating a new market. We're 100% convinced this is the future. We are sure that we will grow very rapidly, and we're starting now, and we're seeing numbers multiplying because people are interested and they love the product Bloom developed. And we see that we will achieve, yes, we will. I mean, we have our forecasts. It is a multi-billion-dollar market, just to say the least. We need to do things right. There are a couple of other companies trying the same, and we wish them well, because the more we have, the faster people will understand what it is about. Today, we don't have only one smartphone. There are many on the market, and this helps people understand what it is about. So speaking about market here is really a challenge. Regarding the company today, the company has 60 employees which are in the company. Additionally, we have another 100 people perhaps working externally, helping develop certain different tests. So we have partners. It's all our IP, but we have different partners. We have companies who do the production for us, so the CDMOs. Where the plan is to grow very fast in Europe and then to enter the US at the right moment. So this is basically the plan of the company. We just entered the market in Switzerland, in Germany, in Austria, and now the next 2 or 3 European markets will follow, as well as the next markers. So we entered the market with the ferritin, so the iron deficiency test or iron test, and we'll enter the AMH test and the TSH test. So AMH test for egg cell reserve and TSH test, which is the thyroid test. Those will be available in the next weeks. And next year, we plan a number of new tests also, which will be added. So we have new geographies, we have new tests coming, and we already see a strong traction in the market. That's basically the overview. And we have had a range of investments, very strong investors backing us, and we're happy to move ahead with them and some new investors joining.
Wonderful. I want to ask a little bit about the U.S. entry, because it's such an important market, and making sure that those that are watching or listening are clear in terms of diagnostic versus therapeutics, and if you could just kind of distinguish that.
Well, to be very frank, some investors are a bit careful with diagnostics. Some think that you cannot earn money with diagnostics, that it is a commodity, that it's all about therapeutics. But there are some flaws here. Because first of all, with the increasing importance of personalized medicine, diagnostics will become ever more important because it's a diagnosis and a therapy. Ideally, one person one diagnosis, one therapy. For the next person, it will be completely different. So the importance of diagnostics will really increase, and it will be much closer to therapeutics. So this is number one. Number two, what we're seeing is that with the information we get and the machine learning we have, our data will be crucial to develop new therapies. So here again, we're very close to therapeutics. So in fact, making a difference between diagnostics and therapeutics is the wrong approach. The same applies for genetic information. Today, we know if someone has cancer, depending on the genetics, a certain therapy will be the best. But this is just a small part of the truth. The other part is the clinical information, all the other data we have to then find the best possible therapy. And we have now the first pharmaceutical companies approaching us, wanting to learn from our data, wanting to apply it for the development of their therapeutics.
And just to clarify, I think I was referring to the FDA process because, again, for some of those that are listening, they may think that this falls under the typical drug development when in fact it's not.
No. The advantage of diagnostics is that the approval process is much faster. So you need to perform certain clinical trials to prove that your diagnostic is a good diagnostic. This will take a few months, and then you send in your application, and this just takes another few months, and then you're through. So it's just perhaps, let's say, maximum of 8 months, 4 months clinical studies, 4 months approval process, and then you're in the market. So it doesn't take that long.
Perfect. And so sounds like coming into the US is going to be relatively soon, hopefully sometime next year. Coming back to the point that you just recently made, as well as at the onset around the analytics is really crucial, is again, in a purely anonymized, purely GDPR compliant fashion, you're obtaining not only individual information, but really kind of almost like a population or segment of a population around a particular disease. That starts to give you a lot of information, a lot of interesting insights and features that, to your point, can go into drug development, into therapies, and that's really the power, right? So if you could just go a little bit more deeply, and then maybe with a case study or an example that just kind of really hits it home for us.
Yeah, so we can start with ferritin because it's where now we have the most of the data. We have some on COVID as well because we have a COVID test, but the largest data set now is ferritin. And again, the personal information and the medical information only joins on the smartphone of the individual. So individual tester, we have no access to that. So the ferritin, the iron test showed us that certain medication has a strong influence, and this was known before. So today we're working with a company who has they treat iron deficiency with infusions and shots, and they are in 83 countries globally. And they now want to learn from our data in order to perhaps add certain supplements to their therapies, which then will need to be approved, or add certain, even certain other medication may have a positive or negative effect. So adding those which have a positive effect. And this is something totally new to them. So it's very actionable also information to improve therapies, to improve drug development.
Excellent. I wish we had a little bit more time, but I think we're about at the tail end. So I'm going to pass it back to Christine. Please go ahead.
Thank you so much. I must say so many of the topics that you discussed are near and dear to my heart. So it was really incredible to hear how convenient life could be in the future. Again, I want to thank Dr. Kohlmann for your time and your expertise, and Scott for moderating. To our participants, please join us for our next session, which will be on climate change and sustainability. Thank you all.
Thank you. It was
Thank
a pleasure.
You. Appreciate it.